Hi everybody, this is Tony Biaggi again, coming to you from the Fastbraces.com campus in Dallas, Texas. I'm the founder of Fastbraces and the inventor of our technologies. This is our wonderful show where we present to you successful dentists that apply Fastbraces technologies in their offices. We're extremely fortunate to have with us today the man from England, Dr. Stephan van Vuuren. Dr. Stephan van Vuuren is an amazing dentist who's helped us over the years and has been with us for about over 10 years.
Over 10 years.
Welcome, Stephan.
Thank you, Tony.
This is quite an honor to have you here. It really is.
It's nice to be here.
When did you fly in? Yesterday?
We flew in last night into a roasting oven.
Yeah, it's almost 100 degrees today.
It's too much, too much. I'm missing the United Kingdom.
Yeah, do you?
Oh yeah.
And you just finished with the Queen's funeral.
Unfortunately, we did.
And now we're moving on.
We're moving on. Long live the King.
There you go. Where are you from originally, Stephan?
I'm originally from South Africa. Born, bred, raised and schooled at the University of Pretoria. And I moved over to England in 1990. Worked as an associate around London. And in 2000 I bought my own practice. And Bob's your uncle.
Wow. Where exactly is your office located in London?
My office is in central London. To be specific, Angel. It's called Angel. And yes, quite central.
It's quite a nice area. It's central. People can get to it easily.
Very busy, very easy. To be honest, commuting in London is such a pleasure. It's easy. And people from all over London can easily get to me, if need be.
Wow, that's what kind of services do you offer in your office?
The practice has actually changed so much over the years. From really a general dental practice, we are now more focused on specialized work, oral surgery, endodontics, periodontics, and cosmetic work to an extent. And then I am in charge of all the orthodontic work. Wonderful.
And of course you're doing Fastbraces. When did you start with Fastbraces? What was the year? Do you remember?
It was in 2012, the year of the Olympics in the United Kingdom.
Wow.
I came here to Dallas in May of 2012.
Wow.
I remember.
So over a decade.
Over a decade ago.
What an incredible time. And of course, you've had such good success with Fastbraces that you were also the recipient of the very first Athena Award, which we give to one dentist from around the world for their excellence in clinical treatment, not only for the difficulty of the case, but also the speed and how quickly it's done. I think it was an underbite and you did it in about 117 days.
It was an underbite case. And it was probably about 117 days. I didn't even think in terms of how much time I was going to spend with it.
Yeah.
I just literally followed the steps as you've taught me all over the years. And the outcome was predictable and it was fantastic.
And was it a surgical case? I think you had told me that somebody had recommended jaw surgery to that
Absolutely,
individual.
it was jaw surgery indicated, but the patient wasn't too bothered about his profile. And he just wanted his underbite resolved. He wanted to look like a normal person. And I said to him, why not? I'm sure we can do this, without a doubt.
Yeah, that's
and we
incredible.
got started, and he's the happiest patient out there.
You know, we've seen more and more of our doctor providers utilizing the patented technology of Fastbraces to restore the alveolar bone in areas where it could be deficient, have hypoplasia. And, you know, quite a few of those crossbites that seemed quite difficult actually resolved themselves in a very efficient manner.
Absolutely.
You know. What other cases can you think of that you were able to do? I know you had a few open bite cases you finished so quickly in about 100 days.
Yes, the open bite cases are actually not quite difficult to do. None of the cases really are difficult to do. It just comes down to case selection and recognizing the hyperplasia or the hyperplasia, the bone disease that is in place, and then following the steps as you have taught us over the years and applying the correct forces, low continuous forces over time.
Yeah, no, absolutely. And you've also helped us teach this technology to doctors, all over the world.
Oh yeah.
In London, your home country of South Africa.
Yes, I've been out there many times presenting seminars. Thank you very much.
What are some of the moments that you sense when a doctor sees Fastbraces for the first time at your seminars? What is it that they like the most, or that makes them want to begin using the technology from what you've seen?
I think they're truly amazed by the fact that we can actually manipulate alveolar bone, resolve hyperplasia in a very predictive way without any auxiliary techniques or things out there.
Sure. All we have to do is put the wire in the slot to activate the system. Yeah.
Just trust the wire to activate the system.
Yeah, and the way the wire interacts in the slide, and also the side elbow extensions that create
the elbows is everything. The elbows is everything.
Yeah, no, it's without getting too technical, I think that's this unique design has been so innovative from the beginning. It's helped us
even with your classic bracket, which was also so effective and so successful. I could easily continue with classics as well.
Sure.
But we've got better brackets out now.
Now you've moved on to the turbo Fastbraces and the turbo extra.
Yeah.
You use the turbo in the hypoplasia cases.
Yes, and turbo extra and a hyperplasia.
Excellent. So basically turbo for the crowded cases and turbo extra for the spacing type of
cases. No, the long elbows, keeping teeth so beautifully upright whilst you're shrinking the bone of the hyperplasia. It's amazing. Yeah. It just works. It's an absolute dream.
Let's talk about the retainers a little bit. We really don't recommend retainers anymore for the back teeth since we grow the alveolar bone, right? Can you elaborate more on that?
I was very skeptical about it, but I had to sit myself down and think about this very carefully. We are not out there to manipulate molar positioning.
Sure.
We have to respect the molar positioning as it is, as this is in harmony with your masseter muscles and your team J's.
Yeah, everybody has their own molar relation, like they have their own eyes, nose, skin, and so forth.
Absolutely. You know? And why force these molars and premolars into a position that they're not particularly happy with?
Yeah, that was an arbitrary ideal of the old class 1 theory, yeah.
So pretty much all my cases I finish without removable retainers now. The only ones that I would still issue removable retainers to are the past hyperplasia cases.
If they had spacing.
If they had spaces, just as an emergency in case a bonded retainer fails.
Now we still give retainers for the anterior teeth, primarily the incisors, because people want perfection. They don't want any signs of aging on the teeth. They want their smile.
But we don't want them to wear it too much.
Yeah, and they can even get a fixed retainer behind their teeth. But pretty much from the canine back, the teeth are free. Once you grow the alveolar bone,
they need to settle in where they want to be.
Yeah, just like a natural bite. When you bite and your teeth come together in occlusion, that's what keeps them there. So no, not having retainers or getting rid of them to such a big extent compared to the old thinking, I think it's one of the reasons and the proof that this technology pretty much restores the mouth to where nature would have put it in to begin with.
We respect nature.
You know?
We don't want to inflict extractions on a patient. We basically work with the patient, with the bone, and with the tooth mass we've got.
Absolutely. No, non-extraction therapy is what we do.
Why do tooth mutilation?
Yeah, no, this is great. What else? What else would you like to share with us?
I think for me, the highlight when I present a seminar or when I provide technical support to other dentists is just that moment that they start understanding what it is about, when that light goes on in their minds and they can actually put everything together and they see the magic.
Yeah.
I live and I breathe Fastbraces. It is just the best.
Yeah. Well, thank you. Thank you for coming.
Thank you, Tony.
We'll have you again.
Of course.
Absolutely. Every time you come to the States, you got to come by.
Of course.
Yes.
I'm always here.
That's right, because you're going to Austin after this.
Austin next to go and see some friends and then back home.
Awesome.
Home is where the heart is.
Well, everybody, if you enjoyed what you saw today and want to keep learning from successful dentists that apply Fastbraces technology in their patients, follow us on Instagram, on YouTube, on Facebook, and subscribe to all of our channels. You can also go to fastbraces.com and register for the free online seminars. I'll see you soon.